Hey everyone, let's take a quick look at SC PEBAs. They're a monthly premium, and this is specific to folks that are retirees. We're going to compare the 2021 premiums and the upcoming 2022 premiums for funded retirees, partially funded retirees, and non-funded retirees right here. So we'll get into it, and let's look at non-funded first. So after you call SEPBA, you get in contact with them and they determine your eligibility for your funding status. They'll give you one of those three funding status categories. And so if you're currently retiring and you're, at the end of 2021 here, and you're about to get onto Medicare A and B as your primary, you'll look into the Medicare Supplemental Plan from the South Carolina State SCPEBA, which is a Blue Cross Blue Shield of South Carolina, essentially health plan. They're the administrator for the health claims, and Express Scripts, PBM, is the administrator for the outpatient drug coverage for this group supplemental health insurance plan. And so when you're on these plans, since they are rated according to your funded status, you'll click on the funded status or the year and the funded status. We're going with non-funded first, and we're looking at Medicare Supplemental for the retiree. So as you can see, it's pretty expensive for a retiree just to have supplemental coverage with Part D included into it. $500.38 is well above market value. That's why I'm doing these videos, is to showcase that if you are a retiree and you're part of the 20% that are participating in these non-funded retiree insurance plans, the market shows that it can save you a lot of your retirement dollars. So $500.38. And so let's compare that to what's coming up in 2022. So as you can see, it looks like they show a lot of stability for this funding because it's well above market value, in my opinion, and I show you that in many case study videos for Medicare Supplement Plans, Medigap plans, which are the individual marketplace for supplemental coverage that is standardized, and it is very much a secondary payer and coverage, just like the supplemental plan from the state, from South Carolina PEBA, administered by Blue Cross Blue Shield of South Carolina. And so if you are looking at, look at this might be a change. Yeah. So if you're a retiree and spouse, which I just helped a retiree spouse from this year, look into their retiree insurance, their Medicare supplement insurance, and they did not choose the non-funded retiree insurance offered by SCPEBA, which is $1,051.04. We saved them right around $900 a month on the Medicare supplement with the standalone Part D drug plan alone. So just multiply that by the years that he would have gone to pay for that supplemental plan if he had enrolled into it. And that's just not only just year one, but year two, 3, and obviously when people are retiring from the state, typically you've had so many years of service that this is going to be your last Medicare supplemental plan, especially if you rolled in with the state. Okay, so that's the non-funded for retiree spouse. As you can see, retiree with a child that's 26 years or younger, $761.92. That's pretty expensive, but your child has to be 26 years young or younger, and then full family, you would have to go ask SCPEBA who would qualify under this non-funded retiree status that is a part of your family member. So this, even though this is high, in some instances it might be something that would be able to help your entire family with healthcare benefits. Okay, let me see, and then it also goes to like the retirees and a spouse that's not eligible for Medicare. So I helped a couple that were both eligible for Medicare, and you can see that the rates differ here. So it goes down a little bit to 1,000. No, it stays the same, $1,051.04 for full family. Looks like it goes down for the supplemental if the spouse is not Medicare eligible. Retiree not eligible for Medicare, and spouse eligible for Medicare. Again, it's 1,051.04. Full family is 12, just 1,300. Let's call it that. And they do have ancillary products, but I have not done a deep dive on these. I've done some on the dental, and it does not cover what some of the standalone plans out there cover, because Medicare does not cover routine dental, vision, or hearing, and you may be losing those benefits when you transition onto Medicare. So that's why they're offering these benefits. But there are marketplace plans specifically designed to fill in those gaps that Medicare does not cover. Okay. Oh, and also too, a big thing is their tobacco use. There's always a markup, or just an increased rate premium when you do use tobacco products for any of these available policies for you, your family, you and your children. Okay, so let's continue on to the 2021 monthly insurance premium for partially funded retirees. So as you can see here, it starts out for the Medicare Supplemental Plan. It starts out at just under $300, so $299.02. And with the spouse, it's $600.52 and $652.20. With a child that's under 26, $452.88. Full family, $805.92. So as you can see, the more with partially funded, your rates and your premiums go down pretty significantly. From $500 to $300. That's a $200 in savings just for the retiree alone. So if you are working those long hours for the state or your employer that's a member of PEBA, then it might be well worth it for you to work a little longer if you are about to get a better funding position for yourself, or better funding premium for yourself, your family members. So just something to think about while you're in your working years. Okay, so that's the 2021. Let's look at 2022 for the monthly insurance premiums for partially funded. Oops, right here, yeah, 2022 for partially funded. So are there any differences here, 2021 to 22? So it looks like there's no differences in the retiree, but there are differences and a little bit of rate adjustments for the retiree and spouse. That goes up from $652 to $655. The retiree and child goes up from $452 to $456, and then the full family goes up full $10 from $805 to $815. And so it looks like the rest of these go up as well. Even looks like even the dental goes up just a little bit, just $1 or so. And I'm just looking back and forth really quick just to see what else is changing. Yeah, and then so you guys may be asking about the carve-out plan. I don't recommend the carve-out plan because of their challenging claims processing that they have. It's not as streamlined as what a Medicare A and B does. A and B is for your primary, and what a Medicare Supplemental Plan is designed for as your secondary payer. Since it's the secondary payer, it's more streamlined, it's standardized, and the carve-out plan shows that if you have more utilization, more medical use, then you will pay more out of pocket. So that's a risk that you have, even though the plan may be, a little bit cheaper for yourself. So just understand the risks when you're transitioning into Medicare. Understand that the Medicare Supplemental Plan is designed to help cover the hospitalization, which is the deductible is $1,400. The 20% Part B limitless max out of pocket of the 20% coinsurance gap. That's another high out of pocket that your Medicare supplemental coverage from SCP covers. And that's exactly how Medicare supplements work, because they're standardized in the individual market. Okay, so we've looked at that so you can look at these if you're in these retiree eligible and non-spouse. You can look at these yourself, but it doesn't look like they change very much, which is really good, because the South Carolina does have a trust fund when it looks to help its retirees into their golden years, into their healthcare coverage. And so it's much like the trust fund for the Social Security for Medicare, the hospital trust fund. So the state has its own trust fund to help fund each its employees in their retirement. So there's just three. There just happens to be three categories that it's a little bit complicated for you to discern where you are, and if you have family members, and if you and in your years of service as well. But it's not too bad if you are know that you've been working in full time for a SC retirement system, or some state-based system that is a part of SCPEBA for 25, 30 plus years. You know that you won't be where these first two funding statuses are, which are non-funded and partially funded. But it really is determined by SCPEBA, because they have set class ratings for employees that were started before 2008 and May 2008, and employees that began in after May 2008. And they also have another class 2, where it's if you started before I believe 2012 and after 2012. So that's where it gets a little complicated on discerning your funding status, because they know the different classes, and that's not something that I go in depth to. Okay, so lastly, we'll go to, you've worked all your working life not only to pay into the Social Security Trust Fund, a hospital trust fund, but to pay into the healthcare trust fund for the state of South Carolina, which means you will be fully funded. And so this is the 2021 monthly Medigap premiums for fully funded retirees. And so that must be a good feeling if you're fully funded, and it looks as if the rates come down dramatically. So as you can see, let's just say here for 2021, a retiree can get a supplemental plan for $97.67, and for 2022, it's the exact same. So the only thing that changes on the fully funded is the dental plans. Yeah, the dental plans. Yeah, is the dental plans. All the retiree spouse, retiree and children, and full family, as well as the Medicare, as well as these other categories, don't change as well. Let me take a look. Just doing this on the fly here. Looks like the dental plans and even the carve-out plans. Looks like the carve-out plan stays the same. The Medicare supplemental plan stays the same. The dental does go up, and so looks like if you're fully funded, you don't have any rate adjustment increases, which is a really good thing, and that's a good place to be in. I will say, though, that even though it looks really nice at $97 and 67 cents, $97.68. So that is really nice for you, the retiree, because it includes Express Scripts, BPM, Pharmacy Benefit Manager, uh, uh, outpatient drug coverage. And their formulary, if I gave you the login for formularylookup.com on our website here on startmedicare.us. Hold on one second while I bring it up. Here we go. There it is. And it's the state retiree insurance. So I gave you the pharmacy lookup. So medications is a big factor when you're going into your retirement or when you're transitioning onto Medicare, because there can be sticker shock when group health insurance plans pay for high tier medications, tier 3, tier 4, tier 5, tier 6 medications, and you didn't have any cost sharing with it. That's not the case with Medicare, because Medicare is the administrator for Part D enrollment and Part D spending. And so there's limitations on your spending, and it seems like they wouldn't do that to seniors, or they shouldn't do that to seniors, because that's when you use that's when when beneficiaries actually use more medications, because they're due to age and due to disease and their health condition, right? So just go down to I believe it's formulary lookup. I have a few things here. So there's a lot that I go into. There's a question for everything. So basically all you do is go to each one. If you have a question on funding, if you have a question on participation, like I said before, if you are fully funded, there's 79% 79% participation soon for retirees who are eligible for the fully funded premiums. There's 59% participation for retirees who are eligible for partially funded premiums, and there's only 20% participation for retirees who are eligible for non-funded premiums. So if you know someone who is paying and is in that 20% participation, they can look to marketplace plans, and it's not like we're not comparing another similar or another non-standardized Medicare supplement plan. These are Medicare supplement plans is what we're talking about in the individual markets. They're standardized by by federal law, and they're regulated and highly protected with Medigap protections and guaranteed issued rights in each and every state's Medigap letter plans A through N for the state of South Carolina. So I implore you to do your research, make sure you understand the individual market, look at the research that I've done for you. Literally in 2014, over 216,000 Medicare supplement policies were purchased by South Carolinians, by retirees, just like you. So it's a very common thing, and I realize you've worked all your life to get onto a supplemental or retiree plan from the state of South Carolina, but I implore you to use your logic and sense to make sure that you aren't overpaying for your health care, and also giving away your retirement dollars, when it's very clear that if you are non-funded or partially funded, the participation drops drastically for retirees. And so this is a study done by GRS Consulting from for the South Carolina South Carolina retiree healthcare plan. Sorry, I can't talk here. And then this is all public knowledge as well, and it was disclosed June 30th, 2019. So I wanted to give you guys all this research and information, because I keep on getting questions about the SCPEBA retiree insurance. Yes, it's good insurance. Yes, it has a Part D drug plan, but I want to make sure as a agent licensed in the state of South Carolina, my resident state, as well as my home state, where I grew up in Columbia, South Carolina, went to Pontiac Elementary, Spring Valley High School, graduated from Newberry College, played tennis at Newberry College, and graduated from the University of South Carolina. I want to make sure that you, my neighbors, had the transparent information for you during your golden years. So I hope this video has helped. Again, I was looking up the formulary lookup for you, and I got sidetracked there. But if you go to formulary lookup, and I'll add it if I don't have it on there. .com. I'll give you my login and password, and you can literally look up tier medication by medication, your expensive or your high tier medications. And so say it's Forteo, which is for osteoporosis, and so you click on Express BPM, and then that's the state, Express Scripts, and then you click on State Health Plan of South Carolina, and as you can see, it's covered. So you just want to make sure your medications are covered when you transition off the group state health plan onto the Medicare Supplemental Plan. Even though it has drug coverage, you want to make sure that you don't have any surprises. So it's for this particular prescriptions at 92%. Sorry, there was that Forteo. Well, let's do it real quick, guys. Sorry, I'm just doing this off the fly. Okay, Forteo is at 96% for the state health plan for South Carolina. That's the PEBA, and it's preferred. It's actually a tier 2. So this is normally like a tier 3, tier 4, tier 5. If you're if you're looking at the marketplace standalone Part D drug plans, and that's where I think the Medicare Supplemental Plan from the state separates itself, is the Part D drug plan that's attached to it, since it's a group Medicare Supplemental Plan. That's where it really sets itself apart for those that have high cost and prescription drug coverage. So if you are non-funded, though, and if you are partially funded, you still want to look at the marketplace. If you are, relatively healthy, or not wanting to pay the higher premiums for their coverage, as well as having the Express Script as their PBM, then you can always contact me, Mike at MedicareSavings.us. I leave all of my information on the videos, and I hope you have gotten something out of this. Please share this information, because even though it looks as if I'm trying to play SCPEBA, their supplemental plan, I just got more and more calls, and literally had beneficiaries asking me, why is this Medicare Supplemental Plan $1,000 when you're showing me a $68 supplemental plan for my wife and a $75 Medigap plan, not supplemental, Medigap plan, and for the retiree and his spouse. So literally just at $150 for two, as opposed to $1,050 for two people. So I hope this video has helped. I know I've said that before, but take care. God bless.